first issue I would like to raise is that surgeons should be aware that postoperative hypoparathyroidism after thyroidectomy is a iatrogenic disease. So the surgeon has done something wrong, either by resecting inadvertently a parathyroid gland or 2 or 3 parathyroid glands, or autotransplant the glands. Autotransplantation is a iatrogenic maneuver from my point of view, which is that is not that clear in the guidelines. But basically, if you resect and or you autotransplant the parathyroid glands, or 1 or 2, then you have a reduced parathyroid parenchyma and the patient will develop hypo-PTH and hypocalcemia. Some surgeons, refer to risk factors, large goiters, Graves' disease, Hashimoto, or even metabolic issues such as vitamin D. But in the end, whatever the initial surgery or even central neck dissection, whatever surgery was done, in the end, the issue is that the parathyroids are reduced in number, left in situ. So this is why we developed the idea of this parathyroid gland remaining in situ, which we think is an absolute requirement to prevent hypoparathyroidism. If you leave the 4 parathyroids in situ after total thyroidectomy, the risk of permanent hypopara is less than 2%. If you leave just 3 glands, you are running the 5–10% risk of hypoparathyroidism. And if you leave only 2 or 1 glands, you now move in the 15 to 20% risk of hypoparathyroidism. So my plea would be, please keep the glands in situ. And the main issue to prevent hypoparathyroidism is leaving the parathyroid glands well vascularized in situ. After adjusting for PIGRIS, maybe the only issue that deserves further research is why for the same PIGRIS, young women have a slightly higher risk of hypoparathyroidism, particularly after benign disease. In this setting, my guess is that some hormonal issues here, maybe high estrogen, circulating estrogens, may be involved in the pathogenesis of hypocalcemia, always associated with low PTH. So with that exception that requires further investigation, why young women are more prone to hypoparathyroidism, the main issue here is the preservation of the parathyroid glands in situ, avoiding resection and avoiding autotransplantation.